Medical cannabis reform has been a topic of conversation that is on everyone's mind at the moment. Yes, the TGA, the Therapeutic Goods Administration of Australia, finalised their open submission where they posed 29 questions, which they say will help determine what the future of medical cannabis access looks like in Australia. At this stage, no one really knows what is going to occur, but in the interests of transparency, we believe that it's important for you to know what OnTracka thinks about this. What did we write in our submission? We're going to go through all that today in episode 52 of the Higher Living Show with Chad. Let's go. The first point that we think is important is looking at new standards. This is important. Now, we're putting on the medical lens, and this isn't going to be something that is compulsory. This is what we look at in terms of a raising the bar initiative that can come into the Australian market. There's going to be areas that we tap into later, particularly around pediatrics, why we think this is very important. But let's just think about someone like myself in the past that had cancer. What sort of products do I want? If I'm receiving medical cannabis in healthcare, I want the very cleanest, most organic medicines that I can access. The second one we think is very easy, and we believe this is going to have a lot of support, but all products should have COAs that can be accessible by patients. We believe that should be in a digital format, and each patient should be able to understand what are the majors, what are the minors, what is the information that is essential as a patient that they need to know around what they are consuming. And at the same time, it doesn't stop there. It should then be linked to a national registry so that we can conduct pharmacovigilance, i.e., real-world data collection around how people are feeling, what are the effects, how safe are these medicines, what sort of symptom changes did we see, what were the dosing ranges. There's so much information that is going to move this industry forward, and having something on the label where patients are engaged, they know what they're consuming, and they can contribute to a continual registry is something that we strongly believe in. Simply what we believe is that nothing should be changing. We believe that if you look outside medical cannabis, many beneficial therapeutic agents carry a risk profile. The position that we put forward was referencing data from a real-world data study that OnTracka completed on what would be deemed a high-potency THC flower, and what we were able to demonstrate is that those adverse events were under 2.5%. We've actually just completed another real-world data study with medical cannabis in Australia on a very complex group of patients where flower was consumed. It was balanced with other with other products and other formulations and formats. And again, we saw an excellent safety profile of 2.1% reported adverse events, and they were rated of a mild scale. So not significant, not moderate, and 2.1%. Again, highlighting how safe these options can be when supported by the right care approach and when there's the right monitoring that's in place. The real-world data studies and clinical trials that we run, it is very evident to be able to look at, okay, we can use the data to help form decision-making. So we believe that there's a place for data collection within this new format of what medical cannabis can look like, and that is kind of linked to a whole idea of what is called pharmacovigilance. So basically, we believe there should be a mechanism that's in place to be able to understand how all patients, how different subgroups, how people across the lifespan, how are we responding to different products, what products are best for certain people, and how we can drive down into what brought many of us to cannabis, which is the medical properties that exist within this growing field. We need data to accelerate the pace of change and the adoption of these medicines into what we would call like failing aspects of healthcare, for instance, mental health care. Anyone who wants to say that the mental health care system is working, we've got major problems, and the early data suggests that medical cannabis can play a role. However, it's very dependent on the format and formulations, the doses, and other factors that are crucial to ensuring that medical cannabis can be in the conversation in terms of mental health. The next area was around peds, so pediatrics, children and young people. We have some views on that, and we think the focus should be not restrictive to carers of families and children. Obviously, there needs to be careful consideration, but we need to take an approach which understands that at present, if a family is at their last resort and they are with their specialist and their specialist has a personal bias against medical cannabis, that family are probably going to be driven to an illicit market. Is that the best way to be able to support children, young people, and carers? A specialist, a cannabis specialist who is also focused and a specialist in pediatrics is the best person to be able to be making decisions to help families, carers be able to determine what medicines could be used by their son or daughter, and at the same time having real world data registries to be able to help clinicians and researchers to group those patterns together to ensure that we're making the very best decisions. One of the focus areas was if individuals with a history of mental illness or substance misuse should be restricted from accessing cannabis. We clearly believe that isn't the case. We believe, and we reference real world data studies again that we've completed on very complex patient groups where we see cannabis with the right structure, with the right monitoring, with the right specialist support program around it, to have an extremely safe profile, to be able to see symptom changes that are clinically significant across multiple domains. That information in itself warrants the need to ensure that some of our community's most vulnerable are not restricted to be able to access these very promising medicines. And despite there being certain prescribing that has occurred within the market, that should not preclude society's most vulnerable from not accessing these medicines. Homegrown has a role, and it can be controlled, and it can be a big contributing factor to the industry and a huge benefit to patients, particularly those that may be limited by some of the costs that are associated with accessing medical cannabis in Australia. Final point was that we also do believe there is space for this idea of a waiting period for products to get registered into the ARTG or an equivalent with the right body of evidence that can be supplied by manufacturers and brands to ensure that they can demonstrate quality, safety, and effectiveness of their medicines. We believe that a period between 3 to 5 years is probably the best for the industry to move forward. These are some of the points that we have put forward as part of the submission, and we would love to get your thoughts. This is Chad from OnTracka and from Higher Living. We thank you for your time.